Hi, my name is Pearl Sanchez, and today we're discussing the skeletal system. The components of the skeletal system include, of course, the bones, connective tissues, cartilages, tendons, and ligaments. We'll discuss the axial and appendicular skeleton, as well as the specific bones in the cranium. But first, let's discuss the way bones are classified by their shape. There are 7 ways. The first is sutural. They're sutural bones. These bones are small, irregular in shape, and they are located between the bones of the skull. Next, we have pneumatized bones, an example of which is the ethmoid bone. And these bones are hollow bones and have air pockets. Next is short bones. These bones are box-like in shape and of course short, and we'll find those in the carpals, for example. Irregular bones are complex, oddly shaped bones with notches and ridges, examples of which include the vertebrae. Next would be flat bones. These are thin bones, parallel in how they're compacted, and examples of these bones would be the parietal bones of the skull, for example. We also have the long bones, and these are thin, slender bones, and we'll see that, for example, in the radius and ulna of the forearm. Lastly, we have the sesamoid bones. These are round, flat bones, example of which would be the patella. So those are ways that bones are characterized by their shape. Those are 7 ways. So now let's discuss the specific bones of the cranium. And I'm going to use this guy here, whom I like to call John. And we're just going to discuss or point out the bones of the cranium as best we can, given the limitations of and detail of the model. So I'll do my best here. And if I'm looking at the screen at all, it's to make sure I'm pointing at the right part of the model, kind of like a mirror. So first we have the frontal bone. We have the occipital bone. I'm going to turn them sideways here. We have the parietal bone. And again, we have that on the other side. The temporal bones on the other side also. The ethmoid is going to be located below the surface here, deep in there. And then the sphenoid bone is going to be kind of, if I were to be able to, pull this off and show you, but it's basically right up in the middle here, pointing as best as I can here, but it is bat-like in shape. So those are the bones of the cranium, and those are included in the bones of the axial skeleton. Also included in the bones of the axial skeleton are the bones of the face. Here we are limited as well, but let me point out a few that are visible using this model. So we have the mandible, the maxillae, zygomatic, and then the nasal bone. Okay. Also part of the axial skeleton is the sternum, the ribs. I'm going to turn them around here. The vertebrae, and that includes the cervical, thoracic, and lumbar. Then we have the sacrum and the coccyx. So that's the axial skeleton. Also included with the axial skeleton is the auditory ossicles, and something that's not easily pointed out is the hyoid bone. So now that's the axial skeleton. So moving on to the appendicular skeleton, that's going to include the pectoral girdle, the pelvic girdle, and the bones of the upper and lower limbs. So we have the clavicle, the scapula, the humerus, I'll show it on this side, the radius, and on the interior side, the ulna, the carpal bones, let's see if I can do this better, the metacarpal bones, and then the phalanges. Then we have our hip bones. This one I keep forgetting, so I'm going to point it out now, the patella or kneecap. Okay, and then we have the femur, tibia, fibula, tarsal bones, metatarsal bones, tarsal bones, and phalanges down here. Okay, I think that about covers all of them in the axial and appendicular skeleton. So as you can see, there are several bones of the skeletal system, several bones of the human body. As such, between the actual bones, the cartilages, joints, and all that's involved between them to stabilize them and move them, etc., there are various ways in which we would see the, I keep looking this way because the skeletal models are here. Various ways in which we would see this in a clinical setting. Some ways, of course, would be broken bones or dislocated shoulder, for example. In terms of the joints between the bones, we might see that by either seeing patients with symptoms and therefore diagnosing and treating rheumatoid arthritis, for example. So these are ways that we see the skeletal system in a clinical setting application. So I think that is it. I was a little bit limited by John here, but I think we covered it as best we can. It was better than his little brother, at least. Thanks for watching.